Welcome to the channel. Today I'm going to talk about an important health topic, 12 questions every hospital patient should ask. Hospitalization can be a difficult experience for everybody, because for two main reasons. One is you are vulnerable when you are hospitalized, you are vulnerable, you are sick, you depend on others. Number two is you lose freedom when you're hospitalized. By that I mean you have to take permission for pretty much everything that you do while you are hospitalized. You cannot eat what you like, you cannot move how you like, you cannot bathe how you like. You need permission for many things. For a lot of patients, if they're on the monitors, telemetry monitors, they cannot move, they need permission. If they have bed alarms, it goes off every time you move. If you have an IV, every time you bend your elbow or hand, it beeps. So it can be a difficult experience. So as a hospital physician for many years, I have observed patients over a course of time and came up with a list of things that you want to keep track of to make your hospitalization a little less stressful. So before you are admitted, most patients go through the emergency department. There are different routes how you end up in a hospital. One is through the emergency department. You go, with a symptom, either chest pain or abdominal pain or a fever or an infection, what have you, or a stroke or a chest, what have you. You go through the emergency department. The emergency department doctor determines that you need hospitalization, either an overnight stay or much longer, many days. Whatever the reason or the duration is, you get through the emergency department or directly get admitted to the floor, from either your primary doctor or a specialist, and then starts your journey in the hospital. After admission, ask the names of your primary hospital doctor and other specialists who make up your physician team, who make up your healthcare team. Your primary hospital physician will coordinate with the team and your nurses will assist you during your hospital stay. Point number 2, checklist number 2, ask your physician, what is my main diagnosis and are there any other newly diagnosed issues? Feel free to express your fears and anxieties about your diagnosis to the physicians and the nursing staff. Don't let the anxiety build until it becomes uncontrollable. Number 3, ask your nurse or physician, how are my illnesses responding to the treatment? Ask the nursing staff in particular about how your condition is progressing and how you can facilitate your own recovery. It's your fundamental right to obtain information regarding your medical condition. Number 4, ask your family, friends, or other trusted individuals to be involved and help support you in your recovery. Yes, it's hard to put yourself in a situation where you feel like you are burdening someone or losing your independence, even for a little while. Understand that these people are an integral part of your treatment team and contribute to the success of your recovery. Number 5, ask to speak with a hospital social worker or care coordinator or case worker if you have questions about insurance and billing related to your stay. Know that every hospital has these individuals who are specialized or specially trained in some of these non-clinical areas. Social worker, care coordinator, case manager, or what have you. These people can help clarify what your insurance covers and how much you may be required to pay. They may not know everything, but at least they might give you some direction into these billing and finance related questions. Number 6, ask to see the nurse manager or charge nurse if you are experiencing ongoing issues with care or communication with your healthcare team about your condition. The person in this role is responsible for helping patients and easing any misunderstanding or tensions that may arise during your stay. Number 7, as you approach discharge. Ask if you should continue taking any of the medications, including vitamins and supplements, you took before you were admitted. This information should be included in your discharge instructions, but take time to fully understand this aspect of your care to avoid potentially dangerous or even fatal complications later. Sometimes supplements can interact with the newly started medications your doctor might have prescribed. Number 8, ask the staff to show you and your caregivers how to perform any tasks prescribed after you left the hospital, especially any treatments that may require a special skill set, such as changing a bandage or giving an injection. After the nurse or physician, ask the nurse or physician to remain in your room while you practice to ensure you are doing it correctly. Ask the nurse or physician to remain in your room while you practice to ensure you are doing it correctly. Number 9, ask your nurse or physician if it's safe to perform ordinary tasks alone, like bathing or dressing or driving or exercising. Make sure you have arranged for help with any of these activities before you leave the hospital. Number 10, ask your nurse or physician if you can or should use any medical equipment such as walker, brace, or a health monitor to help with your recovery and comfort. If the answer is yes, ask for assistance in obtaining these items before you leave or shortly after you return home. Number 11, at the time of your discharge, ask the discharge nurse any questions you have about your discharge information. You should have been provided with printed discharge instructions. Don't leave the hospital without obtaining these. Don't leave the hospital without obtaining these, reading them or having them read to you, and making sure you understand all of the information they cover. Number 12, ask about any follow-up appointments or additional testing. Take a moment now to record anything that's already been scheduled or to schedule necessary appointments in the coming weeks. This 12-point checklist will help you to make your hospital stay a little less stressful and to keep track of your medical conditions, follow-up instructions, discharge instructions, and many things while you're in the hospital. Because what happens is when you're in a hospital, your healthcare team takes care of many things that you don't even know of. But once you leave the hospital, many doubts may arise. How long to take? What if you have this side effect? Or when to follow up? What if I get this side effect or this symptom? You may have a lot of questions after you left the hospital. So having a checklist of items like this will help you keep track of it and hopefully make your hospital stay a little less stressful. Again, I have given these checklist of items in the description below. So please check that while you're listening to this and make a list of things. And take this if you get admitted to the hospital, or you can, give it to your friends or family members if they get admitted. Make sure that they follow this checklist and hopefully make the hospital experience a little less stressful.